Before we insert Spatz 3 adjustable gastric balloon, we always do a check endoscopy to make sure there is nothing wrong with the stomach and the patient is fit for the balloon. Once check endoscopy is complete, we start to unpack the system. This is the facilitator that has to be attached to the tip of the scope, and the scope is well cleaned and dried before we start the attachment. The balloon is connected to the connecting tube, and it is made sure that the end of it is well inside the white part so that it doesn't rupture as we are inflating the balloon. So once balloon is ready, we remove all the rings that are protecting the balloon, and this is done by pulling the two flaps, which removes all the protecting rings. Now the balloon is ready to be mounted on the tip of the scope. Facilitator is mounted on the tip, and it is made sure that the end of the facilitator lies flush with the end of the endoscope, and it is unrolled only till the second hole is visible. Once ready, we start mounting the balloon, and we unroll the facilitator onto the balloon so that it gets fixed with the tip of the endoscope. This can be a little tricky, and with the use of two people's hands, this can be done easily. After that, the two holes are crossed onto the tip of the scope to fix it with the scope. Then a liberous amount of jelly is used so that to make it easier to pass the scope through the throat. Once ready, we pass the scope as we would do normal endoscopy through the pharynx into the esophagus and then into the stomach. Always confirm the presence of balloon into the stomach by retroflexing the scope, and do not start insufflating before one is 100% sure that the balloon is entirely lying in the stomach. One should always visualize that white tubing also in the stomach before starting the insufflation. After confirming, we start injecting the balloon. The 50 cc syringe is laid open and connected through a three-way into the 500 ml of saline mixed with methylene blue dye. We turn the three-way in a way that it allows us to fill the syringe, and then again it is turned the other way to allow the passage of this 50 ml of fluid into the balloon. We must make sure that there is no excessive pressure on our syringe, which ensures that the balloon is lying comfortably in the stomach and is not entrapped in the esophagus. Once 50 ml is inside, we again inject 50 ml more into the syringe by turning the three-way, and we keep counting the total amount of fluid that has been injected, and with repeated maneuvers we can keep on injecting more fluid into the balloon. As a general principle, in the first go we can inject around 300 to 500 ml of fluid depending upon the capacity of the patient's stomach size, the weight of the patient, and the general profile of the patient. We have injected 450 ml of fluid into the balloon, and now we are withdrawing the scope towards the cardia to have a look at the balloon. So now as we withdraw, the balloon can be seen lying comfortably in the stomach, and then we pull the tube out, keeping the scope inside. Then we clean the tip of the tubing and attach the supplied cap onto the tubing. The hands must be very dry, or the gloves should be changed so that it doesn't slip. And once ready, we just release the cap along with the tubing into the mouth, and again with the help of endoscope we can push it back to the stomach. So this is the tip of the cap, which can be easily pushed right into the stomach. We must make sure that the cap as well as the thread passes the cardia and the whole system lies comfortably, and make sure that the facilitator has come out. Thank you.